My name is Ralph Smith, and I work with fedsmith.com. My background might be relevant to some of this topic that I'm going to talk about today, which is the FEHB, or Federal Employee Health Benefits Program. I've been a federal employee, a government contractor, the spouse of a retired federal employee, and I've worked in human resources off and on, mostly on, for about 35 years. So I mention that just because whether you call it human resources, personnel office, human capital, whatever else you choose to call it, the topics are pretty much the same as they have been, with some changes over the years. But today I wanted to talk about the FEHB and the shutdown. And the reason for that is health insurance is important to you if you're a federal employee, whether you're working or not, or whether you're a federal retiree, because you need your health insurance. And normally in a shutdown, this is not a problem. And it may not be this year, but something has happened that raises a couple of questions that you really should think about and should pay attention to, because it could affect your health insurance as the shutdown goes on. As you know, we're now entering a record territory. It will be as of tomorrow, and I don't think it's going to end before then. So we don't know what will happen the longer this goes on. Now, with regard to the FEHB, first, it's not a government appropriation. It's governed by or paid for with a trust fund. The government, Congress, doesn't have to issue an appropriation for it to continue. As in past shutdowns, the expenses for your FEHB are paid by this trust fund, and that's happened ever since it started this time around on October 1st. And that's likely to continue. But a question's been raised saying that basically it might not continue. So you need to think this through and pay attention, because it would affect you. Normally, you can make changes throughout the shutdown. Uh, that is, open season still occurs, you can change your health insurance plan, or if a life-changing event occurs under the OPM guidance, then you can make the change. Shutdown doesn't affect that, and the open season's coming up pretty quickly. If you're furloughed or in a non-pay status because of the shutdown, you're not expected to make premium payments while the shutdown continues. The agency share and your share of premiums will accrue, and they'll be deducted from your pay once your pay resumes, which hopefully will be soon. You don't get the chance, simply because you're furloughed, to cancel or change plans outside the normal rules. So you have to wait till open season for most of us to change, if you choose to change. While the coverage continues, some administrative functions associated with health benefits may change. By that I mean the people who normally administer your health benefits plan in your agency may be furloughed. They may not be there. You may not be able to ask questions or get answers. Well, that's going to be tough if that's the case, and good chance it will be. Now, what's coming up now that's affected this, and how does it affect you? Senator Lankford is a senator from Oklahoma, and he sent a letter to OPM on October 30th raising several questions. And I'm just going to read those questions because they're directly relevant to this topic. First, what is the OPM status on the Federal Employees Contribution Trust Fund? Second, when will the trust fund hit net zero? What is the timeline for when insurers will be notified of the lapse in funds? Do legal options exist to continue paying the employer-provided contributions for health care after the trust fund is empty? What's the risk federal employees face if their federally provided health benefits are no longer funded? That gets to the heart of the question. Do you still have health care? What's the plan to ensure federal employees will be held financially harmless if a lapse in funds for their health insurance occurs? Well, these are very direct questions. They're certainly worth asking, and Senator Lankford has posted it trying to get the answers, and I suspect OPM will answer these questions very quickly. Check back on the FedSmith site, and we'll certainly provide answers either through a video and/or an article as soon as the information becomes available. But you want to pay attention to this, and obviously that's what's happening. Now, if you're wondering how much money is in the trust fund, which gets to the heart of this question as well, we don't have specific information, but this is an estimate based on publicly available information that may help, may make you feel better, may make you feel worse, but here it is. Using OPM's publicly posted numbers, that is $20 billion in the opening balance and the annual outlays for the FEHB of about $72 billion for the program based on recent projections. So if you got $20 billion and your outlays are about $6 billion a month, that means you've got about 3.3 months that the trust fund will last using normal outlays as a guide. Now, whether that normal outlay is currently applicable or not, we don't really know, and we won't know. But we do know the trust fund won't last that long. So what happens? And that's what Senator Lankford is asking. Some things to look for in your FEHB that are going to affect you. First, plan for the fact your share of premiums may not get billed the usual way. You're going to see a lump deduction when things go back to normal, which hopefully will be very soon, and the trust fund issue may go away. But this is still going to happen. Right now, you're going to see, as your pay resumes, a large amount of money come out for the amount of money that you would be paying for your health insurance. So plan for it. Keep an eye on announcements from your agency human resources office, what they're doing and what the status is of your premium withholdings and whether you can remain in pay status for the purposes of benefits. Different agencies may be different. Some HR offices may be up and functioning in some way. Some agencies, they may not be. Ensure that you're eligible for the monthly government contribution if you're still an employee. And check your plan hasn't inadvertently been suspended for some administrative reason. I've worked in personnel offices off and on for a number of years. I've worked around them certainly for a number of years. Mistakes happen as in any human organization. You want to make sure you haven't been dropped. Just make sure you're still in this and you still have health insurance. If you retire or transition during the shutdown or have changes, that is a new life-changing event, somebody dies, you get married, that kind of thing. Track the deadlines carefully and know when your year starts. Open season's coming up. You can change plans if you want to. It doesn't happen right away. It'll happen in 2026, but know where you stand. So this is where we stand. We don't know exactly what's going on with the trust fund for the Federal Employees Health Benefits Plan. You want to keep up with this. We'll try to keep you advised through videos and through articles. That's about the extent of it. I wish I could tell you when it's going to end. I can't. Nobody can. Senator Thune thinks it may happen later this week because there's various discussions going on involving different parties, and we hope they resolve it quickly. It's strange, or it's perhaps ironic, the FEHB is applicable to federal employees, so you don't have to worry about your health insurance. At the same time, the big issue, as far as the Democrats are concerned, concerns subsidies for health insurance under Obamacare. Now, when Obamacare started, of course, it was called a plan that would prevent people from having to worry about health insurance. Obviously, the estimates have been seriously underestimated as to what the cost would be. And SNAP payments, health insurance benefits under Obamacare aren't being paid at this point. Normally, you'd be exempt from that. But as the shutdown goes on, it looks like you're getting into the part where it could potentially affect you. So pay attention. We hope it works out for you. Thanks for watching, and we'll be thinking about you. Please keep in touch, and best of luck.